Okay, so I'm here with Dr. Dominic D'agostino. He's an assistant professor at the College of Medicine, Molecular Pharmacology, and Physiology at the University of South Florida. Dr. D'agostino is involved in cutting-edge research, developing and testing nutritional and metabolic therapies for neurological disorders and cancer. So he's kind of on the cutting edge of all this research, using ketogenic diet for therapeutic purposes, and I'm really happy to talk to him, and I'm stoked that he gave me the time. So, hey Dom, how's it going?
Very good. Thanks for having me, Tristan. Appreciate it.
Yeah. So, maybe we can just start out with some basic questions and talk about nutritional ketosis, and maybe just start out with like a basic explanation of what is nutritional ketosis.
Okay. I like to talk about nutritional ketosis after first describing fasting. Because nutritional ketosis really does mimic the physiological or biochemical metabolic state of fasting. So when we stop eating, we mobilize our fats for fuel. And our body tissues use fatty acids quite well for energy. The brain, on the other hand, does not really transport fatty acids for energy very well. So as the liver accumulates and increases in fatty acid metabolism in the liver, you get the production of more or less what I'd call water-soluble fat molecules, which are ketone bodies. And then ketone bodies spill into the blood with greater fatty acid oxidation. And they, in the absence of glucose as a primary source of energy, the brain has availability to these ketone bodies. And the ketone bodies can, I think their primary function from an evolutionary standpoint is to ensure that there is sufficient and readily available fuel for the central nervous system, for the brain. So in a state of prolonged fasting, you have suppressed glucose, your glucose availability is dropped, and the suppression of the hormone insulin drives hepatic ketogenesis. And ensures that the levels of ketones stay high and that fatty acid oxidation is staying high. Now carbohydrate restriction mimics the state of fasting. So by restricting a macronutrient in the form of carbohydrates and eating fat, you can maintain a suppression of insulin, and it's augmenting fatty acid oxidation for fuel, just because you're eating fat and you're also mobilizing more body fat for energy. And the suppression of insulin through carbohydrate restriction drives, and to some degree protein restriction, drives hepatic ketogenesis. And the ketone bodies then serve, over time, they start to serve as a major fuel for brain metabolism. And in many ways, not only are they an alternative fuel for your brain, but they have a lot of signaling, important roles in metabolic signaling, and they function to turn on various genes that play a role in antioxidant pathways. I mean, our lab is really focused on elucidating all the signaling processes that are activated with ketosis, with ketone administration.
Awesome. So you worked with DARPA, right? You were kind of involved with some research for the Navy and for Navy SEALs?
Yeah, well, we're funded, most of the funding that I've had is through the Office of Navy Research, and that is part of the Department of Defense. And so that has funded our ketone research. And my ketone research, actually, I got interested in ketone research because I saw that DARPA had been funding studies for like 10 years before I got into this at the University of Oxford University and also at the NIH. And some great work is being done in Kieran Clark's lab at Oxford and also with Richard Beach at the NIH. And these people inspired me to pursue this path, to develop ketone supplementation so you could more or less circumvent the need for severe carbohydrate restriction to produce any level of ketosis in the blood. And with the understanding that delivering ketones in the form of an oral supplement is basically giving your body an alternative form of energy that has advantages over glucose for enhancing the production of energy, especially in our brain and in our tissues. So I became very attracted to that idea for the use for oxygen toxicity, because special ops divers, military divers, they use what's called a closed circuit rebreather, and has advantages because there's no bubbles and there's a stealth component involved in this. A disadvantage is that if you dive too deep, you risk oxygen toxicity seizures. And predicting oxygen toxicity seizures and preventing that was basically the foundation of my research. So as we delved into the mechanisms of why oxygen toxicity occurs, I got more into understanding potential ways to mitigate oxygen toxicity, looking at drugs, looking at antioxidants, and I stumbled upon the Charlie Foundation website. And I was like, there's this whole foundation here. They use a diet, the ketogenic diet, and the research indicated that it worked remarkably well. When drugs failed, the diet worked amazingly well in these kids that had drug-resistant epilepsy. So I was like, wow, I want to try this strategy for oxygen toxicity and do some experiments in the lab, and connected with a number of ketogenic diet experts that have been treating a lot of patients, and they gave me a lot of encouraging advice on how to go about doing this. And in short, it just led to a very interesting field of research for me. I've always been interested in nutrition, and as part of my undergraduate training, nutrition science, and it's great to bring nutrition back into what my PhD was in, neuroscience and physiology. So I'm studying kind of like nutritional neuroscience, if you will, and that's been really fun. And I just feel really fortunate to be able to do this kind of research. And I think the applications are very broad. So it allows me to connect with a lot of people from a broad area of interests, from epilepsy to cancer to ALS to glucose transporter deficiency, like rare metabolic diseases, and then also the sports community. I think people like you and other people are starting to realize that low carbohydrate diets and nutritional ketosis is a very viable strategy to extend your performance, and especially endurance performance. And now we just completed a study in weightlifters and advanced weightlifters, and did the diet and compared it to the study that's of interest to people that are really involved in weight training, bodybuilders especially. So that's another area that there's very little research on it. So we're kind of like the first people to attempt doing research in this area to look at very advanced powerlifters, strength athletes, and determine how they adapt to a ketogenic diet versus a Western diet. Wow. And it's very clear that they lose much more fat, and it's also very clear that you can gain muscle on a ketogenic diet. So I was kind of up in the air on that when we started this. I thought they'd probably lose a couple pounds of muscle, but they were actually able to gain muscle on a ketogenic diet, which I found to be very exciting.
Yeah, I think that's really interesting. Actually, I've been doing a ketogenic diet for maybe 6 weeks now, and I kind of tapered down my carbohydrates, and I kind of eased into it. I'd heard about it, and I was listening to some podcasts, and I'd seen some interviews with you and some other people, and I don't know, I just found myself, even before I'd heard about the ketogenic diet, I just found myself cutting out carbohydrates, every source of carbohydrates, just because I felt better when I wasn't having a high-carb diet. I'd always find, I was doing intermittent fasting, so I would intermittent fast, and I would get my workout in the morning. And I always found that I felt so much better in the mornings. Like every time I had my first meal, and my first meal wasn't high glycemic at all. I mean, I would have some like raw grass-fed milk, which it's debatable how high glycemic that really is. I mean, lactose, for me, I'm very tolerant of it, so I was able to have like a lot of milk, and I never felt a huge insulin spike, but I always felt my energy just start to lag. during the second half of the day, and especially around 2 to 4 o'clock, I'd almost always want to take a nap. And I've got a 2-year-old daughter, and she takes naps sometimes in the afternoon, so I found myself napping a lot with her. But when I got into ketosis, I kind of found that I had a kind of steady supply of energy throughout the day, and I really liked it. And I wasn't, at the time, I was trying to build muscle. I wasn't super serious about it, but I was steadily building muscle, and I was really focused on strength gains. And I was lifting weights for about a year, so I actually found that when I switched into ketosis and finally one day just said, okay, no more milk. That was my last carb. I was like, I had milk, and then every once in a while I had some plantains or like half a banana, but I cut that all out one day. I just said, oh, I'm going to try it. And 6 weeks later, I'm still doing it just because I really like how it feels. I wanted to go back to something you were talking about, the funding for this kind of research, and I think it's really cool that you're getting funded by the military to actually do this research that's going to help so many people actually heal themselves naturally, further down the line. And even right now, so many people are getting interested in it because of what you're out there saying and what you and people like you are out there doing. And it seems like such a long shot for any pharmaceutical company to ever fund research that has anything to do with using diet and metabolic therapy, unless they have something that's patented and they're actually able to get their return investment from. It doesn't make sense from a business standpoint. In fact, it actually makes sense from a business standpoint to suppress information like this and maybe try to discredit it with propaganda and public relations campaigns. So who's actually doing your funding for your research that you just finished with weightlifters and powerlifters?
Yeah, that particular study was funded by Quest Nutrition, actually, believe it or not. Quest Nutrition, they make low carb bars, and they become increasingly interested in very low carb, ketogenic bars. So eliminating all the carbs and the fiber from their bars and coming up, with potentially ketogenic, pre-made ketogenic meals. And these are things that the people in their R&D are interested in doing, and they are so interested in it. They're very scientifically curious, the people at Quest Nutrition, and they put their money where their mouth is, basically. So they're interested in this idea: is the science behind this really legit? And if so, maybe it's worth commercially creating a line of ketogenic diet foods. And bars, because there really is no bar. If you think about it, you can't go to GNC or any health food store and buy a bar and eat it and then stay in ketosis. So even the Quest bars that I have, a lot of Quest bars around here, even if you eat one, it knocks me out of ketosis. And even the Atkins bars will knock me out of ketosis. So it would be great to have a bar, which was kind of like a whole foods source of bar, that one could take if they followed a ketogenic diet, and they would be able to stay in ketosis. And I travel a lot, so just throwing some ketogenic bars that actually taste really good would be really great thing to do. Now, there are other ways, I have kind of beef jerky and other forms of ketogenic snacks that I've had, like macadamia nuts and pemmican. Yeah, pemmican is something. Yeah, I've bought pemmican, and sometimes I use that for travels. I don't know if I have it here. Yeah, I have in the fridge behind me. I have sardines, packed in extra virgin olive oil. So it's nice. A combination of the oil, and it's a pretty good ketogenic traveling item. But to have a bar that tastes good, like a chocolate bar that has a macronutrient ratio that's 75% fat and 20% protein, 5% carbohydrates, and it tastes really good, that's my vision. That's my blue sky kind of vision. Create a line of foods that have that. And for me, this is kind of a self personal interest thing. I was like, I would love to work with a company, that does this. And Quest, they're very scientifically curious. They're like, let's do some ketogenic diet studies here, And so they were kind enough to fund that study, and we've got some interesting data. We got a lot of data, and writing it up now. We were lucky to connect with Jacob Wilson's lab at University of Tampa, who had the means to do a lot of innovative research in this area, and do a really good recruitment of the right kind of advanced athletes that I was most interested in, to see if they would adapt to this kind of dietary regimen, which was very different than what they had been previously following. I actually thought they would lose some muscle, but it showed that you can gain muscle on a ketogenic diet, and that's pretty inspiring for people. And I think it's the data, when it's published, it'll be out soon, will I think the ketogenic diet scares people. Low carbohydrate diets kind of scare people because they think they will lose muscle, they will lose strength.
Yeah.
And that's not the case. But one caveat to the study, and it's not really a caveat, is that on a ketogenic diet, if you do a short, an increase in carbohydrates to the end, you can rapidly increase your strength. A short carbohydrate load for 1 week for 8 weeks of following the diet can replenish glycogen levels in the muscle, which probably contributes to greater mechanical leverage in the gym, and also greater performance on things like a Wingate test, where it's kind of an all-out kind of test to look at your capacity for anaerobic performance. So I think what you're going to find is that I think there's going to be a hybrid kind of diet. Maybe a ketogenic diet would be great, and then maybe periodically throwing carbohydrates in when it's game time, per se, or when, and a lot of triathletes, they might be able to maintain 100 grams of carbs if they have 4 hours of output a day and still be in ketosis. And then on the day that they have their event, they could throw in, throughout their event, whether 6 hours of bike riding or something, throw in up to 200-300 grams of carbs throughout that and titrate that in and be able to use that. So I think you'll find, but I think being in the state of nutritional ketosis really pushes your body to use fat more efficiently for fuel, and ultimately that's going to spare glycogen and extend your ability to perform long duration.
So there's probably, I don't know if there's any studies about my next question, but maybe you've had experience in your own life jumping back and forth between metabolic states, between burning fat and being in ketosis and being on a high carbohydrate diet. I get the creator of the Atkins diet, actually, I think he recommended titrating up carbohydrates and not actually being in that state of high protein intake and super low carbohydrates for a very long time. The Atkins diet was very different from what people are doing now for nutritional ketosis. But I'm curious, it seems to me like a flexible metabolism is a really advantaged state for us to have. I mean, in any state of an emergency, like if you live in a major city and the lights go out, they say that after like 24 hours, or I think maybe it's 3 days, there's no food left in any cities at all. So I mean, if you've never actually fasted and if you've never gone into ketosis, you might have a really hard time with that. But it seems like the hunter-gatherer kind of ancestral diet that people are so hyped on nowadays has a lot to do with being metabolically flexible and dealing with minor stresses or major stresses in the environment. And what have you found, either personally or through your research, about how ketogenic diet affects, how long-term ketogenic diet might affect your ability to switch back and forth between metabolisms? And some people say that it might be damaging to be in ketosis for a long time because you'd be carb intolerant, and they would say, some critics would say that you might develop certain food allergies that you wouldn't have before. But is there any basis to that? And yeah, what do you think about that question?
Yeah, maybe for some people, and I think with a prolonged ketogenic diet, you may you will likely have carb intolerance if you throw them back in at the same level you were eating them before. So I think you have to, like anything else, like you have to kind of titrate it back in would be a good idea. Now, from a personal perspective, as what you touch on, I think that metabolic flexibility has tremendous practical advantages. I haven't, what time is it? I haven't eaten since I woke up this morning, like 7. So I'm not, I'm going on like 10 hours I haven't eaten, and I feel completely fine. I could, I have talks to give and papers to grade, so I'll be at it for a couple more hours before I eat. That could have never happened if I was not in ketosis. I would have hypoglycemia, I would be irritable, and I would be, out of my chair going somewhere to get food. And I think for traveling, for example, not too long ago I was in Haiti, actually, in a part of Haiti, they really didn't have electricity or, food availability just wasn't there. So I had to basically spend a lot of time in a fasted state. I think I was there for 3 or 4 days and basically fasted that whole time, or had very little food. And I was perfectly fine, and actually there was a pretty high physical demands during that trip. And I find that that's the case. I think I like to call it resilience. So you have metabolic flexibility produces a resilience, a cognitive resilience and physical resilience that you otherwise wouldn't have if you didn't, force your body to get into a state of nutritional ketosis. So I think there's a lot of practical advantages. For the person that's dieting and try to lose weight, nutritional ketosis suppresses your appetite. So that's completely clear. I mean, my ketone levels are probably pretty high now. I didn't check it, but I'm not hungry. So food is not controlling me. Like, I basically determine what I eat, and I love to eat. I have a pretty good appetite, and when I sit down to eat, I don't want to have to eat a certain amount and stop because I got to eat like 2 or 3 hours later. Like, I sit down until I'm satiated, and that's good. I think in years past I would eat 6 meals a day or something. I don't do that anymore, and find that kind of impractical and not very. When you look at food preparation, cleanup, and everything else associated, cost and whatnot, the ketogenic diet has been a better way for me to live. And I think there's a lot of practical performance advantages in the office, and in a daily life, and also with performance, physical performance.
So when you pop out of ketosis, this is kind of more of a personal question. When you do find yourself popping out of ketosis, do you know because you feel yourself come out of it, you feel the switch in your brain metabolism? And how quickly do you get back in ketosis when you have been doing it long term and kind of switching in and out of it likely over the years? How do you find that works?
So I go out for sushi maybe once every 2 to 3 weeks, and I will eat, I don't know, anywhere between 2 to 4 sushi rolls, and with the rice. And sometimes, I probably eat some stuff on top of that too, but that'll kick me out of ketosis, and I feel really good. It's almost like, bam, like I have more energy. Now I have glucose too on top of the ketones. And surprisingly, I get a big jump in my ketones kind of immediately after, and then glucose levels really never go too much above 100, but then I get reactive hypoglycemia. Then my glucose within about 2 hours will go down to like low 60s again, even with that. And it depends on the kind of carbohydrates. But generally, if I go out and break the ketogenic diet for dinner, I feel fine. I feel great. I wake up in the morning earlier than normal, very hungry. Mm-hmm. So because of the insulin that it's released, and it probably ultimately over time, the ketone levels go down. The liver gets a source of glucose and shuts off ketone production. You release insulin. I usually wake up, like if I go out and have sushi 7 or 8 o'clock in the evening and go to bed that night, I'll wake up at like 4 o'clock in the morning and just be like pretty starving, And if people have, I guess it's similar to binge eating. If you go and kind of starve and then eat, the more you eat, the hungrier you get because your insulin gets spiked and you have reactive glycemia. So that it's not like a painful, and it's kind of mild. It's just I wake up a little bit hungry or something, and I'll just, I don't know, have a little bit of coconut milk or something and just try to get back in ketosis. I use a lot of coconut milk, concentrated coconut milk.
Okay.
And that's a source of MCTs and really low in carbs. And I add it to my my coffee too. I add butter and coconut. I kind of switch on and off.
Yeah, and I see your MCT oil in the back there.
Yeah. I have a lot in the lab. I have
sure.
MCTs and ketone supplements.
It's interesting. I've been doing ketosis for 6 weeks, and I live in Ecuador right now. Like, I'm an expat. I'm an American living in Ecuador, and it can be really hard to get certain products. So I've never even tried MCT oil. I think I actually ordered some, and I'm supposed to get it in the next week or two, depending on how quickly my courier can bring it out here.
Yeah.
So, but yeah, it seems like MCT oil is like the essential thing that everybody says you need to get into ketosis. But I pretty much used butter and tallow and grass-fed beef. And I was just eating a lot of butter and tallow. And I don't know, for me it seems like titrating down the carbohydrates is the easiest way to switch into ketosis. Like, if I had just gone from eating a bunch of really sweet, sugary foods and tried to switch into ketosis, I know I would have had a really hard time. But I think after like 3 days, so the first day when I got into ketosis, I went and I deadlifted, or this was like 36 hours in, I deadlifted, and I was still steadily gaining strength from like the strength building cycle that I was on. And I was really surprised. I thought I was going to be completely burnt out in the gym, like nothing good was going to come of it. But I've actually steadily increased my strength and haven't really had to use any supplements other than a little bit of magnesium every once in a while. And I find that eating greens is really important. Without the availability of like a potassium or a magnesium supplement, like I don't have a potassium supplement here. I have to wait until I can order one online from the U.S. and it'll take weeks. So I haven't used one. I just use greens and have a couple cups of leafy greens every day, and I find that I maintain ketosis just fine. And I don't know what my blood glucose is. I don't know what my ketone levels are. I've never measured it. So, I mean, all this, people get so obsessed with like numbers, and I mean, for me, it seems like most diets are like, okay, do you feel good? Do you feel okay? And are you performing okay in your general life? You can work. And for me, that's what it's all about, is actually maintaining that steady state of energy output without having to put so much energy in. And I think it's really awesome.
Do you smell it on your breath? Do you have like a fruity odor on your breath? So that would indicate it. And
yeah, well, actually, my sweat smells a little bit different. It doesn't smell bad. My urine smells a little bit strong, like really strong in the morning. And my breath, I haven't really noticed. I asked my wife, and she doesn't think it smells very different. But I mean, I go long periods without food, and I never really when I eat, it's because I should eat. Like, okay, I'm really sore right now, or every once in a while I will get hungry, especially in the first days in the morning. Like you were saying, like maybe your blood glucose drops a lot in the morning. And I found that morning time I would be the most hungry, but then throughout the day, I'd never get hungry. So I think it's a really cool, it's a really awesome diet in that it seems like a really grassroots thing. Like, there is certain research that's getting funded, but like, I mean, what are the products that have to benefit from ketosis? I mean, I guess all whole foods type products and MCT oil, but it doesn't. To me, it's a really awesome grassroots movement, and it's really exciting what everybody's doing. So another question I've got is, have you done any research? I mean, you're into neurology and neuroscience, and it seems like ketosis has a lot of neurological effects. I mean, most people that are in it, they say that they can feel the neurological effects due to different metabolism. What kind of effects does ketosis have on neuroprotection and other things having to do with the brain?
Well, I guess the important thing, the most important evidence of neuroprotection or working on the brain would be seizures. I mean, the evidence for that is really clear, and I think most neurologists won't dispute that the ketogenic diet is actually more effective than most anti-epilepsy drugs, pretty much. So the question is, well, why? So, independent of the etiology of epilepsy or seizures, it seems to work through across the board on a variety of different brain disorders that cause seizures. So I would say it's very neuroprotective, and I think we can clearly say it's neuroprotective. So the question is, why is it doing that? And our lab is doing some metabolomic studies where we can take serum out of the animal or take tissue from the brain, and we can look at different metabolites, up to 3,000 different metabolites, and to determine how nutritional ketosis is altering the flux of energy pathways in the brain. And from our research, we've realized that it elevates many of the Krebs cycle intermediates like succinate and fumarate and malate. These things are elevated, citrate's elevated, and indicating that you have a greater flux of energy through the Krebs cycle, which can create the reduced intermediates to drive the electron transport chain. Not to get too sciencey, but that's the thing that makes the mitochondria generate ATP, makes energy. So it's stimulating the production of metabolites that play a key role in the mitochondrial production of energy. And I think that's just one example by functioning as an alternative energy source, that it's allowing the brain it's preserving brain energy metabolism in the face of some persistent, molecular dysfunction. So if a child has glucose transporter deficiency syndrome and they have the gene and a molecular defect that prevents the glucose transporter from being in the brain, ketosis can be effectively used to treat that child symptomatically. Their brain is starved of energy. So a ketogenic diet would feed the brain ketones as a source of energy, and it can mitigate many of the symptoms of this persistent, disease that's not going to cure itself, because this is a genetic disease. And then you have situations like traumatic brain injury, or like with football, you have concussions, and the concussion can result in a decrease in brain energy metabolism. And restoring that brain energy metabolism is very important for the ultimate outcome of that patient, or that person that got, brain injury. So the faster you restore brain energy metabolism, the faster the brain can help to repair itself. And there's a critical window and I think it'll vary between different types of brain trauma and different types in an older person versus a younger person. But I think it's most important to restore brain energy metabolism as fast as possible, and do it in a way that lowers inflammation. And we know that a carbohydrate-restricted ketogenic diet can lower a lot of inflammatory mediators. So just by simply reducing glucose, you lower many of the factors, inflammatory factors. Hyperglycemia can be terribly pro-inflammatory. So a carbohydrate-restricted ketogenic diet will lower glucose. It will lower insulin. Insulin signaling triggers inflammatory pathways. It lowers insulin and elevates ketones, which have an anti-inflammatory effect in and of themselves, but also activate a genetic program, if you will, and activate specific genes that can confer antioxidant protections and suppress different pro-inflammatory pathways. So that's pretty clear in the literature. And so I feel that as far, I guess you have Alzheimer's disease too. That's glucose, impairment of glucose metabolism. So the big ones that are out there that you're probably asking about are like Alzheimer's disease, brain injury, Parkinson's disease, ALS. All these disorders in some way or another are pathophysiologically linked to glucose dysregulation or impaired glucose metabolism. And ketones could be a way to to basically metabolically target that defect and restore and preserve brain energy metabolism. And that's, what we're in the business of doing and finding out and elucidating all the molecular pathways through which that occurs. And our lab has more or less a top-down approach. So we look to see kind of what works from the top and identify the different ketogenic agents and the formulas that work, and then we kind of work towards identifying the molecular mechanism through which it works. And a lot of science is funded from a bottom-up approach. Like, you mechanistically, look at all these different factors in a very reduced preparation, and then build up evidence to go do, and I did some of that research in my earlier years, but I find now, as time goes on, maybe I'm impatient, but I like to do a simple survival study. So, and figure out, what actually works, what extends survival in an animal model of metastatic cancer, or like a particular aggressive seizure model or something, and then screen the agents that work, and then go figure out how this is working, do all the safety testing, and try to get this into the hands of the patients that need it as fast as possible. So that's what I want, our lab is trying to do, and trying to change the paradigm, that kind of the science paradigm of working from the bottom up. Yeah. So we do outcomes-based research initially, and then target mechanisms.
That's really cool. Yeah, it's probably very frustrating to hit a dead end in your research. You put all this energy into making a study, and then it's just like, oh, it doesn't work, so now it's over. So maybe that probably doesn't happen as much in the type of research that you're doing now.
I think it decreases the chances for that happening. Yeah, sure. Yeah.
Okay, so you were talking about Alzheimer's disease, and there's been, I don't know, it's such a hot topic in science nowadays, and you just see like headlines all the time, probably just because it's such a hot topic. So any article you put out about Alzheimer's is going to get lots of clicks and hits. But I've been seeing a lot of stuff about the effects of heavy metal toxicity and heavy metal poisoning on Alzheimer's and degenerative diseases, and all kinds of problems in the body, like the gut biome being affected by mercury toxicity or aluminum poisoning, and high levels of aluminum in the body being linked to Alzheimer's possibly. So does the ketogenic diet have any mechanism by which it might help the body to detoxify and to actually mobilize stored toxins and release them?
I don't know. But that's a good question, and I do have a kind of an interest in heavy metal-induced toxicity, or just, I guess, neurotoxic agents in the environment. Because if you look at the data, if you take, for ALS, for example, if you take people and move them into different locations or expose them to toxic environments, they seem to have a greater potential for getting ALS, and maybe early onset of other neurodegenerative diseases like Parkinson's disease, for example, if you're exposed to certain pesticide residues and things like that. That's an interest of mine. So I don't know how to answer your question directly, but what I will tell you is that I think the ketogenic diet can improve metabolic health, and I think to a large extent the health of our mitochondria and our overall metabolic health, defined as stuff that you don't measure, like metabolic biomarkers in the blood, which we like to measure, markers of inflammation. And if you live your life following a nutritional approach that enhances mitochondrial function and it actually even increases mitochondrial density by forcing your body to oxidize fatty acids and ketones relative to glucose. Now this is basically what happens with calorie restriction, right? Now we know calorie restriction can extend animal survival and can delay the onset of Alzheimer's disease, at least in animal models of Alzheimer's disease. Now, the ketogenic diet mimics biochemically, physiologically, many of the effects of calorie restriction independent of calorie restriction. And I think what you'll find is that, say if you're ApoE4 positive, or if you have a genetic predisposition for a neurodegenerative disease, my recommendation would be that the ketogenic diet can't hurt. I don't really make recommendations, but I would say that the science would indicate that it would be a good idea to kind of at least do intermittent ketosis from time to time. So get your body into ketosis, stay there for 2-3 weeks, and then maybe transition back to a healthy whole foods diet, paleo-like diet, whatever you want to call it, and periodically get your body into ketosis. Maybe you want to do it through intermittent fasting, maybe you want to do it through carbohydrate restriction, but I think that process of getting your body into ketosis can really have a therapeutic effect. And say, for example, you have cancer cells in your body, like precancerous cells or existing cancer cells. So most people do, right? Like I try to live a healthy life, but I probably have some precancerous cells in my body, or maybe cancer, I don't know. I think it would be a good idea to put your body into a physiological state of low glucose, low insulin, and high ketones. And we know through science that this has pretty tremendous anti-cancer effects. Anti-angiogenic, it's anti-inflammatory, it enhances mitochondrial function, it decreases the activation of oncogenes and increases activity of tumor suppressor genes. Antioxidant pathways are upregulated. All these things are associated with suppression of tumor growth, especially suppressing the hormone insulin. And that's what you're doing when you do a therapeutic fast or follow the ketogenic diet. So, it's so simple, right? And no one gets money out of it, but you can't, I've seen people, myself included, actually, I'm put up in a situation where I'm lecturing about this to cancer researchers, oncologists, and you can't really argue against it, that this would be a very useful strategy to do it. I have yet to be challenged that this is not a good thing to do.
To me, it makes so much sense, and actually, I've had kind of like a crazy roller coaster of like diets that I've done. From like raw veganism for a while to going into more of a whole foods and incorporating some animal products I got really sick after raw veganism. I thought I felt great, and then one time I caught a flu, and it was like a week. It might have just been a simple food poisoning or like an E. coli thing, but I was so sick, like I couldn't drink water for a week. And I'm in bed in the room with my wife taking care of me. I was just like, couldn't hold anything down. And I got into that because I had heard of all the awesome health benefits, that people were curing their cancer with juice fasts. I kind of wanted to ask you about that, and you probably don't have an answer because you're not researching it, but what would be the mechanism that these other alternative therapies, such as like juice fasting, seems to actually be working for a lot of people for curing cancer? Is it the restriction of high glycemic, high glucose insulin spiking foods, or is it the calorie restriction? What do you think is going on there?
Yeah, I think, you're taking someone with probably a very suboptimal diet, and you're putting them on a diet that's vastly different and probably tremendously improved as far as nutritional profile and quality of food relative to what they were already eating. Right? So like any change would be a good change to many people, like, a number of people contact me. Some people are doing like everything right, and they get cancer, but usually these are kind of like lymphomas or leukemias. But then again, the majority of people are kind of middle-aged, older people that get a tumor, and usually their diet is kind of pretty poor. So if you put them on a Budwig diet or the Gershom diet, there's a lot of different, or juice fast or whatever, I think this could be an effective approach to stall tumor growth and potentially reverse some of the tumor growth simply through restriction of calories and suppression of the hormone insulin. And also it's anti-inflammatory. The problem is that this is not sustainable, right? So you can do a ketogenic diet and live a much easier lifestyle and have a satiating meals. And if you look at the blood markers of metabolic health, like, just the simple ones are C-reactive protein, triglycerides, glucose, ketones, and the hormone insulin. You can improve all those more above and beyond kind of the other methods, and basically preserve your muscle mass, which is a really important factor in metabolic health overall. And I think it's much more sustainable than following kind of these juice fasting, and because you can only fast for so long. So there may be aspects, and maybe one method may work better for another person. Say if you have if you just can't tolerate fat, say you have an intolerance to digesting fat for some reason, you don't have your gallbladder, but I know a lot of people who follow the ketogenic diet without a gallbladder. For some reason or another, you can't follow the ketogenic diet. Now, a juice fast or a Budwig or a Gershom diet may offer some benefits, but I don't think it would offer any benefits above a good whole foods, plant-based diet, if that's what you want to follow, that's restricted in total calories. So the Hippocrates Clinic, which is in West Palm Beach, I visited the Hippocrates Clinic and talked with all those people and met cancer patients, and I was thoroughly impressed with the Hippocrates Clinic. And
is it a plant-based diet that they recommend, or is it a whole?
It is. Yeah, it's plant-based. It's a raw foods vegan diet, but you cannot argue with the success they've had with their cancer patients. So, you can't, when you have patients there and one after another give a presentation, and these are advanced cancer patients that are standing there today and that are alive today, they took an approach. And basically, when you eat a raw foods vegan diet, it's hard. You can't gain weight on it, for one thing. So you're probably at a point of calorie deficit, right? And then your metabolism adjusts, so you have a decrease probably in overall metabolism, suppression of insulin. So all these things are good things. And then there's things too that they do at the Hippocrates Clinic that are kind of a mind-body thing. They do hyperbaric oxygen therapy, which our lab has even shown it's pretty therapeutic, especially when combined with the dietary therapy. So they're utilizing many aspects that we have validated through science, especially the calorie restriction part. The Hippocrates Clinic is. So that, when people have come to me and they just don't want to do, some vegans just, they're like, they read this and they want to follow the ketogenic diet, and I don't think it's a really good approach for a vegan. And I will direct them to, especially if they're in the area, go to the Hippocrates Clinic. And I've been there, they're legit. They've been there, I don't know, for like 28 years or something like that. So they have a very different approach as far as diet, but it works. And I'm all about results. Like, they prove to me that they're getting results just through their patients, are a pretty good example of that. And they don't claim to treat people. So what they do is basically they open their doors and you come in here and it's a wellness clinic. And they kind of give you the tools to get well, and there's some pretty sick people that go in there and they come out pretty remarkably healthy. So I actually, I went there to try to extract as much information as I could out of the Hippocrates Clinic, and talking with them, and I would like to utilize, our diet is kind of ketogenic diet, ketone supplement based research, but there's a lot of other things out there that are working, and even plant phytonutrients and plant based things that have potential, and I have a new student that's actually working on that. So putting together a cocktail, like a super cocktail of plant-derived extracts that could be added to the therapy that we're working on now with the ketogenic diet and ketone supplements with hyperbaric oxygen is what we're doing now. So there's a lot of things to study out there.
Yeah, and it's so cool. There's such a synergy between all these different movements, and it seems like there's pieces that each one can learn from the other one. And unfortunately, there can be like a lot of dogma on both sides of vegans being against the paleo diet because it includes animal products. paleo diet being a lot of former vegans who maybe, I might have a problem with the other side also. But I think it's so cool when people can incorporate things from both sides. Like, I mean, we have our dehydrator from when we were into the whole raw vegan thing, and it's always on. Like, we dehydrate meat and we grind it up and make pemmican. Having a good blender, like having like a nice, like a Vitamix or a Blendtec blender, there's these little bits that will always stay with me from the raw vegan thing. And I definitely see a high value to the plant foods as medicinal parts of the diet. So it's really cool to hear you talk about that.
Thanks. So I think there are, just getting back to your thing, I think from a nutritional standpoint, it's not a one-size-fits-all, and I think you have to find whatever, works for you. And there's many factors, available. I'm not anti-carbohydrate diet. I have many of my friends, especially performance athletes and weightlifters, follow a high carbohydrate approach, I would say. And they titrate in their carbohydrates to make sure that they're maximizing, that their carbohydrate tolerance is high, because and their metabolic health is also good. So you can do it that way, but they have to eat more frequent meals. So my argument is that my debate would be that you can, replace a lot of those carbohydrates as fat, and not have to. It's very liberating because your appetite's controlled and you don't get hungry, and your meal frequency can drop. So on a high carbohydrate diet, you're gonna, to maximize your performance, probably at least 4 meals a day you're going to need. But I think you can drop that down to 2 or 3 a day with a ketogenic diet for sure. So you can at least drop 1 or 2 meals out of your meal plan a day if you switch to a high fat diet, just because you delay gastric absorption so much. And when I eat fat, I tend to eat it, with things like collard greens or broccoli or asparagus, something with fiber. So you have the combination of slowing, digestion with fat combined with fiber, and you feel satiated.
Yeah, I do the same. I usually, when I make greens, I'll take a little bit of bone broth and then just pile the butter in there, and I've got the greens, you've got the broth, maybe throw some ground beef in, and it's like everything you need right there in one meal, and you don't need anything else the rest of the day. It's really, I think it's great for traveling too, because if you're on an extreme diet, such as if you're like a raw vegan, traveling is so stressful because you're going to have to try to find a good source of organic greens, of juices, whatever you're eating, or dehydrate a bunch of crackers and bring it with you. Whereas with a ketogenic diet, it seems like most grocery stores would have foods that, they may not be optimal, or they may not be able to find organic stuff, but you can always find high fat, you can always find grass-fed butter in most cities. So it seems really convenient for that.
And it's less weight. Like, fat calories are pretty, you get more calories per gram. So carry a little thing of MCT and even olive oil for salads, like a good quality olive oil, and usually a bag of macadamia nuts and some sardines packed in olive oil. I don't bring butter. Haven't been bringing butter, but I know there's ways to do that. Just throw it in a Ziploc bag, and it'll melt, and it'll be okay if it's in a Ziploc bag, and whatever,
Yeah. Well, even on an airplane flight, like for airlines, you can't really bring a big bottle of MCT oil, but you might be able to put in a mayonnaise, what's those little tiny plastic containers, grab a few of those and put it on a tray with a bag of nuts and whatever else you want, and TSA should let you buy without molesting you too much.
Sure. Yeah, I have the little 100 milliliter containers too. I just keep them in my bag, various little 100 milliliter travel containers. And, depending on the length of the trip, I'll fill 2 or 3 of those up and bring them with me.
So you're allowed 2 of those on an airline? Or I'm actually trying to plan, for the next time I fly, what am I going to bring?
I have bought a bag of I think the most I have ever brought was 4 100 milliliter containers. And I threw them into my bag of toiletries, I guess. So I had my toothpaste in there, and I don't know, not too many things really. But I had 4 4, 100 milliliter, maybe they were 60 to 100 milliliter containers in there, and they didn't question me. And I've traveled all over, outside of the United States and inside, and depending on where you're going outside, the regulations vary, and also depending on the people that are actually there at security. Like, one guy may pass you through, the other guy with the same thing may pull you over.
Oh yeah, it all depends on their mood, what they feel like doing.
And country and everything too. So
yeah, it's always fun.
And, the climate at the time, the political or stability of the climate.
So I got another question about going back to your study about athletes and building muscle on a ketogenic diet. Was it very strict, the diet that they were on, and what kind of macronutrient ratios do you think the data will show allows you to build muscle in ketogenic diet? Because I find it's really hard to eat like 120, 140 grams of protein a day. I usually maybe get like 120 maximum, I think. So what kind of macros do you think would be optimal, or does the study show would be optimal?
I think the guys were getting like 3 meals a day, estimated, give or take, maybe like 10%, 75% fat, 20% protein, and like we're really trying to get carbs to a minimum, like 5% carbs. And to make sure they're actually ketogenic, we check their ketones, and we know that they're lying about their diet if they're like, you're not following the diet. So it's like you can't really lie, So checking ketones is definitely essential. And 3 square meals a day is usually was good enough to basically feed. These are young males, advanced athletes with their total calorie consumption. I have to look at the data. We have general guidelines, but 3,500 calories per day. So they're getting a sufficient amount of calories. So if they restricted calories too much, they would not gain any muscle. It would be very hard to gain muscle. So to gain muscle on a ketogenic diet, there needs to be sufficient calories for sure. The training is very important. At University of Tampa, Jake Wilson's lab, they are very experienced in designing designing a program that will pretty much assure that you're going to gain muscle if you're doing things right. And if you don't gain muscle on their programs, then something is holding you back. Your nutritional regimen is holding you back. So even the control diet with the Western diet, they gained a significant amount of muscle. They actually gained a little bit more than the ketogenic diet, but the ketogenic diet lost so much fat, like the muscle to fat ratio was better.
Did they DEXA scan them, or how did they know?
Yeah.
Okay.
They did a combination of DEXA, and they also did a muscle ultrasound.
Cool.
To look at muscle thickness with ultrasound, and then we did blood work and things like that. Yeah, but they did a DEXA combined with ultrasound and looked at muscle thickness.
That's so interesting. Was the muscle from the ketogenic diet more dense because there was less inflammation and less?
Yeah. So what's pretty clear in the results is that by week 8, these guys were tested, and then there was 1 week where they titrated carbohydrates back in throughout the week and then retested. So a novel aspect to this experimental design was that they did a carb up for 1 week at the end. And at week 8, it was very clear that their glycogen stores were depleted because 1 week of carbing up increased their muscle glycogen and water retention. So their lean body mass was just as high as, or higher than the Western group. So they gained muscle, but then they had this huge boost in muscle after one, at least from a DEXA, because it's looking at water content of the muscle. So they had this huge boost, just with a simple, 1 week refeed of carbohydrates. Wow. And that's interpreted as just restoring muscle glycogen. So that needs to be appreciated and kind of written up in a way to kind of indicate that. So even though the ketogenic diet after 8 weeks, they were able to gain muscle, but the Western diet group might have been a little bit more, that had a higher muscle. But I think that what needs to be appreciated is that your glycogen stores are depleted. So after you replenish glycogen stores, I think I think the ketogenic diet, I got to look at the data now. The ketogenic diet may have edged out the Western diet as far as...
That'd be fascinating if you're actually able to gain more muscle. And I wouldn't be surprised because, I mean, there's less inflammation. There's probably less breakdown of the protein in your muscles when you work out. And maybe less of a need to intake so much protein because I guess on the standard, like they say, what is it, 1 pound or 1 gram or more per lean pound of body weight. And to me, that always just seemed kind of high. I don't know. It just always seemed like maybe that's overshooting it. And I don't know what the science is behind that. But I'm really interested in when this is published, just to look at the study.
Yeah, I'll definitely post it to you or send you even, the earliest copy we have. So.
All right. So, like, it's been like an hour, and I could just keep asking you questions for hours and hours. But I'll just kind of try to wrap it up with maybe a few like personal questions, like, I mean, what kind of herbs and supplements and stuff do you personally use in your diet on a daily basis?
On a daily basis? I used to take a lot of different supplements, but I've transitioned to just more whole foods based diet, and I don't notice a difference without the supplements. There are a couple things that I'm kind of because we do research on it, one would be ketone supplementation. Like I'll use that intermittently, especially if I'm testing different things. The antioxidant idebenone, I think it's a form of coenzyme Q10, and idebenone are things that I think are can significantly increase mitochondrial function, preserve mitochondrial function, I think, especially if you're on a ketogenic diet. Other than that, I take a baby aspirin every other day, and branched chain amino acids. So during the day, I don't eat a meal during the day, but I'll take a mixture of branched chain amino acids and some essential amino acids. Like, I didn't do it today, and I don't do it every day, but on most days, I kind of take a branched chain amino acid supplement during the day, and I find that, and I'll take it sometimes right before workout too, branched chain amino acid supplements. And I'm kind of a believer. We have some research going on now that it may be good for preventing muscle wasting with cancer, what we call cancer cachexia, that it may stall that in forms of aggressive metastatic cancer, that it can prevent the breakdown of muscle protein. So we're looking into that. And, I've always had, branched chain amino acids were part of like my supplements that I was kind of interested in to begin with. So
what ratio do you think is best for the BCA? Some people say 8-to-1 leucine. Most of the products are 2-to-1, 2-to-1-to-1.
I have a preference for the Scivation makes a product called Extend, and it's a 2-to-1-to-1. Leucine, isoleucine, valine. I think it has citrulline malate in it and some electrolytes and maybe some glutamine too. We're actually testing that product, but without the glutamine, because glutamine could be a source for cancer cells. I don't think glutamine causes cancer, but if you have cancer, you probably don't want to be taking glutamine. It's debated. So we're using that branched chain amino acid formula in our experiments right now. And that's what I take, and that's what I recommend, actually. Besides that, I'm pretty light on supplements. I'm not a really big supplement guy.
I've got like a stack of so many supplements, and I'll take like every once in a while. Maybe I'll take some of this, but just because I have it, But pretty much the same. I take the BCAAs pretty often, and sometimes some herbs. Like, have you heard of Cissus quadrangularis?
Yep.
I actually wanted to ask you about that because it's got something called ketosterones in it, and I don't know what kind of relationship those will have to ketones, but I found before I got into ketosis and I took that, it like dried me out, really, like it made me dump a bunch of water weight, and it almost, now that I think back, it kind of felt like it switched me into ketosis just from taking this Cissus. Do you know much about the ketosterones in that?
Well, ketones are ubiquitous in nature, right? I mean, there are ketone bonds in a lot of, we've heard of raspberry ketones. So it's a carbon double bond, with oxygen. It's a ketone bond is very common in nature, in organic chemistry. So ketone bodies were named by a physiologist and not a chemist. So ketone bodies are they have a ketone bond, but they can be used as a source of energy, whereas many other ketone molecules, like the one you described, or raspberry ketone, for example, which are kind of like a big fad gimmicky thing. Ketone bodies in the form of beta hydroxybutyrate or acetoacetate are a form of energy that the body can use. So that's the difference between, and the confusion kind of lays because it was named by a physiologist. It's because there's ketones all over, like in nature. They were just named. They are sources of energy that just happen to have a ketone bond in them.
Okay, so it's kind of a misleading name. But for some reason, I don't know. People do say that the cissus helps with weight loss. I haven't seen any studies about it, but that's an interesting herb.
Yeah, I've heard good things. I know people that have inflammation too. I think they use cissus for just a variety of things. So a number of people, recommended that supplement to me. Yeah.
Cool. Let's see. Okay, so I heard I heard an interview that you done a while ago, and I think you said you were deadlifting like 550 pounds, or like a pretty respectable deadlift. You still deadlifting 550 pounds?
I did. Like the last workout, I did 495, which is like 5 plates for 14 or 15.
Wow.
So I can get 7 plates, which is 675. So I can always kind of maintain that. Now, whether or not I'm doing that for reps or like a heavy single will depend on how much I'm eating and how much my training and things like that. So, but I always kind of make sure that I go in and do heavy deadlift, like at least once every 2 weeks, or some kind of heavy, squat movement. And that basically keeps, my deadlift numbers up. But the most I've ever done is like 675 for 5. But I did that at a much higher body weight. Yeah. And about a few years ago, training with my friend Lane Norton, actually, he had like a deadlift bar, and he was kind of screaming at me, and I did at 220 or maybe 222, 225. I did 675 for 4. So I was like 30 to 40 pounds less.
Wow.
And almost the same, and that's following a ketogenic diet.
Yeah.
So my PR before was back when I was doing a relatively higher carbohydrate diet. So now that's why pound for pound, I mean, that's pretty good, and my reps can kind of be higher too with the same amount of weight. So wow. I did. I can't do it right now, but 495 I've gotten for 20 when I was heavier, and I've reproduced that at a weight that was about 35 pounds less. I got basically 500 for a set of 20, and that's a sumo stance instead of a conventional stance. So I'm basically driving with my hips and my legs, and then with a conventional, it's weird. I can pull more off the floor for a single with conventional, but I can't do like the high numbers of reps.
Okay.
So yeah, I don't make it to the gym as much as I used to, but I try to get in there about twice a week. And if I'm traveling, sometimes it'll only be once a week. But I do a lot of stuff at home. Like I have a chin-up bar at home. I do dips and chins and one-arm push-ups or handstand push-ups, stuff like that. I love doing stuff like that, because it allows me, being resourceful, just using bodyweight exercises, allows me to train when I'm traveling.
Yeah, it's so fun too. It's like, I mean, when you wake up in the morning I actually, before I got into ketosis, I hated cardiovascular. I never wanted to do it, never felt like it. I actually find myself just running my stairs. I've got 30 steps coming out to my house. I just find myself running those almost every day now. So yeah, it's pretty interesting. I actually enjoy it. It feels great. But yeah, the body weight stuff it's really fun to do. So when you get into the gym 2 times a week, you said you like to do a deadlift day and then like a squat. Is that what you focus on mostly?
I'll do like a push day and a pull day. I'm trying to think, what's my last workout? Oh, I did, actually my last workout was bent over rows. And I did 405 for sets of 8, actually. So bent rows are kind of a strong exercise of mine. And, I use straps to hold the weight, and So I went in there, I warmed up 135, 225, 315, and then kind of psyched myself up, and then I did 2 sets, one set of 8, but kind of like sloppy form, and then I did a set of 6 and just kept my back more tight, strict form, 4 or 5, and then I left the gym, and from start to finish, I think it was about 15 minutes, 15,
nice.
20 minutes.
That means you're bent over rowing over 400 pounds.
I had to get home for dinner, so.
Yeah. Yeah, sometimes the quick ones are the best ones, though. Well, that's amazing. Oh, yeah. So let me ask you, like, a personal training question. You can help me with my training. I've been doing, I'll do a push day, I'll do a squat day, I'll do a squat day, a deadlift day, and a bench press day, right? So I'm just basically doing a super simple, kind of a linear progression with some periodicity in my reps and my sets. And I'm trying to push my deadlift up. And I don't know what my 1 rep max is, but I can do 160 kilos for I could probably get 5 reps. I've done 2 sets of 3 at 160 kilos, which is 352 pounds. So it's not a strong deadlift at all. But I've been finding in the last few weeks that I've been trying to up the intensity of my workouts. So when I do squats, I've been kind of increasing my reps and increasing my sets at the same time, and just changing my program. But I found that it's really hard to even get a deadlift and a squat day in on the same week and push the same amount of intensity into both exercises. You think I should maybe decrease the intensity of my working days, or maybe just deadlift 1 week, squat the next week?
I would back off a little bit. I think with deadlift, you want to kind of vary your form a little bit. I would say try a sumo stance, and because I did conventional for a long time, and to save my back from injury, I started doing more conventional pull. Yeah. And I did that. It was more of a psychological thing. I took a hit initially, my numbers went down, but then my numbers started to creep back up, and then I went past. For the longest time, I couldn't get 7 plates, and when I went past it, it was a mental barrier. It's wow, my body can handle that weight, and then I went back to conventional and was able to pull it, because mentally I knew I could get the weight off the floor and up. I think people have different tricks. A good periodized plan, periodization works, and we know it works. And I unfortunately I don't have the schedule that allows for that kind of. Yeah. So sorry, I'm just getting a call, but. Yeah, I would get some kind of system and incorporate within that system accessory exercises that increase blood flow to to your lower back muscles for recovery.
Stiff leg deads, or
stiff leg deads, glute ham raises. Also focus, deep squats where you're activating the hip flexors and things like that from the bottom. Is also pause squats too. So go down to the bottom, pause from a dead stop, and then fire back up. And focus on that explosive movement, that firing from a dead stop. So you're not kind of utilizing that stretch reflex from the bottom, because you don't get that with deadlift, right? So you need to be able to fire from a dead position, essentially, bent over position. So there's little tricks. I'm not really an expert in training. I just kind of I'm more instinctive about my training. I have followed I've done Shaiko and Smolov when I was younger, and linear periodization patterns that I've gotten, on the web and through friends. But nowadays I just kind of train it instinctively.
Yeah, that might be my problem too, is because I don't actually plan what I'm going to do ever. I go in and I see what it feels like, and I very rarely have any energy left after I've done squats or deadlifts. I have energy, but I've been squatting or deadlifting for an hour, so I just have other stuff to do. So maybe I'll back off a bit and just do squats and deadlifts on different weeks and maybe chill out.
Yeah,
cool. Okay, so what kind of future research would you like to see, / might you be involved in the future? What would you like to do?
Well, I'd like to move our studies that we call preclinical studies right now in animal models to human studies. And to do that involves networking with the right institutes that have the infrastructure and the expertise to do this, to run studies. So I'm in the process right now of thinking ahead towards that. We have a lot of animal work to do and a lot of therapies to test first, but I mean, 5-10 years from now, I'd like for these things to be in clinical trials, and especially some of the novel. The ketogenic diet already is, and when I got into this research, maybe 2 trials were on clinicaltrials.gov, and then there was a lot of publicity about the ketogenic diet and cancer, and now you'll find about 12 ketogenic diet studies on. So that's a good thing. So I think we're pushing. I think we're kind of making that happen. I think we're a force that the patients are asking, is this available for me? And if not, why not? Why isn't this being available? So it's kind of coming from a bottom-up approach, at least from the patient perspective. They're asking for it, and they're asking their doctors about it, and their doctors kind of give them that deer in the headlights look and don't know anything about it. So they seek out, they seek out people and the expertise that are available to help them. And I think as more doctors realize that patients want this, they'll probably open their practice to it because they know that's money, right? So, following patients is going to be money. So it'll take a while, but I want our research to go in that direction to really form clinical trials on what I view as completely novel metabolic therapies.
But also completely intuitive, and maybe these might even be ancient therapies. Maybe people were using these before and instinctively knew how to keep disease away using metabolic therapy.
Yeah, the ketogenic diet's definitely not our invention, but hey, that's been out there for a while. But the use of ketone supplementation and also we're looking at some glucose lowering agents too. Metformin is one of the more simple ones. We're looking at that too, and the hyperbaric oxygen too is something that we're doing, and we do find that we get a definite effect when we combine it with the diet. So there's a synergism there.
That's awesome. Yeah, it seems like there's a lot of positive movement going on with people using diet to change their life and to manage their own health and take responsibility for their own health rather than relying on pharmaceutical drugs. And it's so cool that there's actually researchers like you who are so, who kind of give their career to this movement and to bringing this kind of information to the people. So I really appreciate you coming and answering questions, and it was really fun to talk to you. And
Thanks.
We'll leave it at that. You got where can the audience find what information on you or anything further that you think that they should know?
I would say I compile a lot of the information, resources, consultants, and actually clinical trials too on ketonutrition.org. So all one word, KETO nutrition, all one word .org. And it's just a basic skeleton of a site, but I have all the links there, that have consultants, ebooks with specific step-by-step instructions on how to get into ketosis, a variety of podcasts and TED Talks that I thought were helpful, so I've compiled on there. So it's become a really good, patient resource. So it leads people in the direction for the information that they're seeking usually. So, and at some point when I get time, I'm going to build a more comprehensive, website and everything. But there's already so many great sources out there. So I just wanted to create a source of relevant information on like one page right there that people can just click on and get the information that they need, the most important stuff, instead of overwhelming them with a lot of stuff.
Yeah, awesome. Well, thanks so much, Dominic.
Thanks, Tristan.